Well, good morning. We are here at the Ryan Nina Community Center. It's one of our city's healthcare centers that is staffed by members of the Healthcare Workers Union, 1199 SEIU. And I want to thank the center's executive director, Kathy Gruber. Kathy, where are you?
Here I am.
There we are. Come right up in here. You can stand in front of Tom. Don't worry about it. He won't be blocking him.
Thank you.
And her entire team, as well as George Gresham. George, thank you, the president of 1199, for hosting us today. And I'm joined by the great borough president of Manhattan, Scott Stringer, our deputy mayor for all of the social services that keeps me straight and narrow, Linda Gibbs, and Dr. Tom Farley, the head of the city's Department of Mental Health, and keeps us living longer. It is most important for everyone that we have a commitment to the health and well-being of our fellow New Yorkers. This center has been a real leader in combating the obesity crisis in our city, which is taking a devastating toll on families and communities across New York. As healthcare workers, they have seen the cost of this crisis, both in lives and in dollars, firsthand. The good news is that awareness of the problem is growing, and so is the momentum for tackling it. The leaders of 1199 are among the many supporters our recent proposal to curb consumption of sugary beverages has received. It is a broad coalition that includes political leaders like former President Bill Clinton, former Mayor Ed Koch, and Philadelphia Mayor Michael Nutter, healthcare leaders like Emblem Health's Chief Medical Officer, Dr. William Gillespie, President and CEO of Mount Sinai Medical Center, Dr. Kenneth Davis, and Dr. Lance Parton, President of the American Academy of Pediatrics, and community leaders like Jack Nunn, President and CEO of YMCA of Greater New York, Richard Berry, President and CEO of the Children's Aid Society, and Pastor Brian Carter, President of the Brooklyn Ecumenical Advisory Group. That and the people standing up with me here today obviously have come together because we recognize that the obesity epidemic is one of the most urgent challenges facing our city. And we just refuse to stand on the sidelines while millions of our fellow New Yorkers struggle with the health implications of being overweight or obese. Nearly 60%, 60% of New Yorkers citywide are overweight or obese. And sugary drink consumption is a key driver of the obesity epidemic in the United States. It is not the only one, that's fair, but it is certainly one of them. In fact, we get more excess calories from sodas and other sugary beverages than from any other individual source. What's worse, these are empty calories that flood our bodies with sugar without making us feel full. And that's a key distinction. If you eat calories from some things, it fills you up and you don't eat anymore. When you consume empty calories, you consume them, they add to your waistline, but it does not give you the feeling of being filled up, so you go out and you continue to eat. Many New Yorkers, I think, don't realize that a 20-ounce soda, which is pretty standard size in this day and age, has the equivalent of 16 packets of sugar. If you were going to have a cup of coffee or a cup of tea, would you put 16 packets of sugar in it? I don't think so. But that's why we're combining our new reform limiting the serving size of sugary drinks with an ongoing public education campaign. And it builds on the work that we've already done to give New Yorkers more information, like calorie counts in restaurants, so they can make better choices about the food they and their families consume. Nobody's forcing them to do it, but it is our obligation to give them the information and the implications of the facts so that they can make better choices. It is also in line with our reforms like our earlier ban on trans fats. And the study released just last week showed that New Yorkers on average consume nearly 2.5 fewer grams of trans fats per meal after we implemented the ban than before. Trans fats are one of the worst things you can put into your body. The study went on to say that not only were restaurants serving healthier foods, it pointed out that consumers were making healthier choices as well. Now, our administration has worked to provide New Yorkers with more healthy options, including creating health bucks, as we call them, that can be used to purchase fruit and vegetables at farmers markets, and making hundreds of green carts available across the city so that families have more access to fresh produce. And as you know, the Tisch family has been very helpful in providing monies to do that. We've also launched Shop Healthy NYC to encourage more neighborhood supermarkets and corner stores to give healthier food prime space in their shops. 80 bodegas up in the Bronx have already signed on, which is crucial because while nearly 60% of New Yorkers are overweight or obese, in the Bronx that number is 70%. Shop Healthy NYC, along with our sugary drink size limit, are important tools in the effort to help more New Yorkers get healthy and stay healthy. Now, the broad nature of our coalition shows, I think, just how urgent it is that we act now in the fight against obesity. Nearly 4.9 million New Yorkers struggle with this epidemic, and each faces a greater risk of developing a host of diseases and conditions, including type 2 diabetes, cancer, hypertension, heart disease, kidney disease, liver disease, joint problems, and blindness. Of course, as we all know, obesity just doesn't affect adults. Even perhaps more tragically, it affects the youth. Among New York City public school students, nearly 40% are overweight or obese, and each faces a higher risk of developing all the diseases that I just mentioned, and tragically, each also faces a greater risk of early death. In fact, obesity is already the second leading cause of death in the city, just after smoking. It's the second leading cause of preventable disease in our city. The number of people dying of smoking is going down. The number of people dying of obesity and the effects thereof is skyrocketing. This year, an estimated 5,800 New Yorkers will die because they are obese or overweight. Now, for decades, smoking was seen as an intractable problem and one too big for local governments to address. But I think we all know that over the past decade, smoking among adult New Yorkers had dropped 35%, resulting in more than 450,000 fewer smokers in our city. And estimates tell us that means roughly 50,000 fewer smoking-related deaths by the year 2052. Our success in cutting smoking deaths to record lows shows that we can tackle the toughest public health problems head-on and make a huge difference, but only if we're willing to act boldly and to target the problem comprehensively. And that's what our administration has done with smoking, and that's what we are going to do and we are doing with obesity. Obesity is the first time in history that you've had a rich person's disease become a poor person's disease. This year, more people will die around the world from being overweight and the effects of that than from starvation. It is a change in the world which is never seen before. This is the single biggest public health problem after smoking in this country, and pretty soon will be the biggest. Now, in addition to the tragic human toll, obesity is also placing a growing burden on public finances. We all complain about our taxes and how much health care costs. Well, obesity costs New York City alone roughly $4 billion each year. Nationwide, that number is $150 billion each year, and the crisis is only going to get worse. We realize that we can't simply treat the effects of obesity. We must help people change their lives before they ever need to enter a hospital, and that's why we brought 10 agencies together to form the Obesity Task Force, and we've launched a citywide effort to expand on our work to tackle this crisis. Led by Deputy Mayor for Health and Human Services Linda Gibbs and Deputy Mayor for Operations Kaz Holloway, the Obesity Task Force has outlined an aggressive strategy for helping more New Yorkers get healthy and stay healthy. Their report, Reversing the Epidemic, includes efforts to help more New Yorkers gain access to healthy foods, learn easy ways to eat fewer foods with large amounts of fat, sugar, and sodium, and become more physically active. It also details new partnerships like Shop Healthy NYC and Shape Up NYC, an effort led by our Department of Parks and Recreation to provide fitness classes at parks locations across the city with the business community and nonprofit groups. And our administration will continue working with a range of partners throughout New York to do even more to help New Yorkers win this fight. So now let me welcome the man who's spearheading our administration's efforts, the Commissioner of our Department of Health and Mental Hygiene, Tom Farley. Tom?
Thank you. The sugary drink portion rule has sparked a national conversation. That conversation has gotten into all aspects of the portion rule, but I want to bring that conversation back to what is at the core of the proposal, and that's the health of New Yorkers. New York City has been hit by an epidemic. Obesity is a distinctly unhealthy condition. It leads to diabetes and heart disease and many other complications that make people suffer. It is killing, to our best estimates, 5,800 New Yorkers per year. Now, that's more than 10 times the number that are killed each year by homicides. Now, if a virus were killing 5,800 people this year, people would be clamoring for government action to stop it. the fact that obesity kills that many every year only increases our duty to respond. Now, people have wondered why this proposal is the proposal we put together for solution to this problem. Well, here's the reason. Sugary drinks are a leading cause of the epidemic. Studies show a strong link between sugary drink consumption and weight gain, and it increases the risk independently of heart disease and diabetes. Studies show that people given larger portions of sugary drinks simply consume more without noticing it. And portion sizes of sugary drinks have increased dramatically in parallel with the obesity epidemic since the 1960s. Now, this obesity epidemic is particularly hitting our city's most vulnerable people. The poor and African Americans consume a lot more sugary drinks, are far more likely to be obese, and to suffer diabetes and other health consequences of obesity. African Americans have a life expectancy 4 years less than that of whites here in New York City. So this epidemic may look different from an epidemic of a virus, but the results are the same: illness, suffering, and death. Now, when an epidemic of this magnitude threatens New Yorkers, it's our responsibility to take action to protect the health of New Yorkers. Now, we're taking many actions to respond to the obesity epidemic, as the mayor discussed, but this one is particularly central. Now, I want to thank people who have supported us particularly. I want to thank George Gresham and the 1199 SEIU that have supported us in many ways in our response to the obesity epidemic, but in particular this proposal. They were early and strong supporters. And I want to thank the elected officials who have had the courage to support this proposal. This is something that they'll take criticism for, but it's absolutely the right thing to do to protect the health of the people we're here to serve. Thanks very much.
Tom mentioned elected officials willing to stand up. I think Scott Stringer is a model for exactly what that takes. It's not always popular. Nobody wants to be denied anything. Nobody wants to be reminded of facts that aren't pleasant. Tom talked about life expectancy of African Americans being 4 years less than for whites. A baby born today, Tom, if I'm not mistaken, has a 5.5-year lower life expectancy. Is that the number?
For African-American males.
African-American males, 5.5 years lower than for a white male baby born today. We've got to do something about this. This is craziness. George Gresham has been somebody that has understood the needs of not just the union and its members that he represents, but the needs of this community. And many of these healthcare providers work here at Ryan Nina. George, you want to say a few words?
Sure. Thank you, Mayor Bloomberg and Commissioner Farley. It is a pleasure to be here today for the forward-thinking idea that we're finally going to do something about the obesity, the scourge that affects so many people. And for those of you who listen that have the ability to vote on whether or not this should become the rule in New York City, please, if you've known anyone, if you've ever known anyone that has suffered from obesity or from diabetes, it is no wonder why we're here today. This is a small step. It is not a big step, but it is an important step. You know, 10 years ago, I lost my father to lung cancer. And I only wish that the regulations that we have against smoking now had existed at a time when maybe it would have made a difference in his life. For us to sit around and talk about this may be an issue of choice, we're not dealing with the future. We're not dealing with the reality of what this means to our community, particularly the community in which many of my members live. This is the right thing to do. We should not allow the simple goal of making profit, the simple goal of making money, get in the way of us looking forward. It's not like we don't have the evidence. It's not like we don't know this. It's not like every day we don't see people in our communities that are suffering from diabetes and the results of what that may lead to. So it is with great pleasure and pride that I'm here today to say that we must begin this fight today, the fight against obesity, the fight for better health within our communities. And this is a small step, but it's a reasonable step for us to make sure that we're looking forward to the health of New Yorkers. It's my pleasure to be here.
George, thank you. Scott, you want to say something?
Sure. Well, I'm very pleased to be here, and for me, quite frankly, this is a no-brainer. Truth of the matter is that drinking soda eventually is going to cause some very serious health issues for people. That's a fact. And I want to start out by just praising the mayor and the administration for once again getting everybody to focus on the health and well-being of this city. This proposal, in my view, is quite moderate. Think about it. All we're saying to people is don't drink so much, take a pause, and then go and get another drink, right? If you really need it, you can get it. No one's banning soda. We're just making it, we're putting it a little higher on the shelf. And I think this is a moderate, reasonable proposal. What I think is fascinating is you would think that the election is happening right now, not in November. I've gotten mailings from the soda industry, television commercials. They're writing in the sky at beaches telling everybody that this is the most incredible proposal that's going to wreak havoc on their businesses. It's just not true. This is a proposal that will save lives, and it's something that we should encourage. I, for one, remember growing up in Washington Heights as a kid, hanging out in the schoolyard, being very athletic in my day, Mr. Mayor. And I know no one thinks that, but it's okay. And what did we do afterwards? We used to go to the bodega or the deli, and we'd say, I got to get a 16-ounce, because we were thirsty, we were tired, and we want to drink a lot of soda. Today, 16 ounce is nothing. Now the kids go in and say, I need a 32-ounce. I need a 64-ounce, not to bring home to their family, to drink themselves. There's a problem out there, and we have to wake up. I want my little kid to understand that there are other healthy options he has, but we need the city and a coalition to lead by example. Parents can't do it themselves. We need help. And standing here with George Gresham and a mayor who gets it, not only this policy is going to change in the city, but we're going to change this in this country and perhaps the world, and we'll all be better for it. I think the soda cartel should stand down, stop sending these mailings, and start thinking about programs to wean kids away from soda that has no nutritional value but will cause them real health impact. Thank you.
Just to put it in perspective, when I grew up, I loved to have a Coke or a Pepsi. They didn't have diet drinks in those days, but the portion size was 6.5 ounces in a bottle. Think about that, 6.5 ounces versus 20 or 30 ounces, which is what lots of kids drink today. And in all fairness, both Coke and Pepsi do understand that their products are not great if you do it if you drink in excess. If you drink a small amount, no harm, no foul. But if you drink the large quantities that have become normal, yes, they're very detrimental to your health. And both have tried to wean us away and move towards low-calorie alternatives. I drink Diet Pepsi and I drink Coke Zero, and that's fine. But the bottom line is we have to do something, or this is going to be a disaster for the health of the city. Before opening questions, let me just summarize today's announcement for our Spanish-speaking New Yorkers. Casi un 60% de los noriaqueños están de sobrepeso o obesos. La obesidad es una epidemia que requiere acciones y nuestras propuestas para límites en el tamaño de refrescos es una forma de combatir esta crisis. Estamos aquí con más de 100 líderes políticos, comunitarios y en la área de salud que apoyan nuestras propuestas. And with that, we'll be happy to take